Good morning.
Good morning.
My name is Abhijit Pawar. Uh, I'm Executive Vice President, Global Operations and Country General Manager for India, R1 RCM Global Private Limited. Uh, uh, Even before I start, uh, I really appreciate for you taking time out from your busy schedule and accepting our invite and being here to be able to have a conversation with you, to share with you what our company is all about, what are our plans, as we are inaugurating our business operations in Chennai. So wanted to really thank you for that. Today I'm here with my colleagues.
Sure. Hi, good morning, everyone. My name is Divya Sikka, and I'm Vice President Operations with R1. I've been associated with R1 for a little over 10 years, and really excited to be here in Chennai, and thank you so much for being here.
Hi, I'm Swati. I lead HR for R1 in India, and I've been with the company for nearly 5 years, and I'm really looking forward to be able to hire and grow the Chennai location over the next years to come.
So before we start, let me give some introduction, background, overview of what our company, what business do we do, what is our India business look like, our plans for Chennai, all those kind of things. Let me set the context, and then once we have our point of view, and then there are any questions, happy to address. So R1 RCM Global is a leading provider of revenue cycle management services for hospitals, physicians, and health systems in United States. So when I say revenue cycle management operation, it appears to be, this term needs to be explained before we even go forward. Healthcare system in United States and healthcare system in India, though at the fundamental level are similar, but there are certain characteristics which are required to be understood. In India, when we go to any doctor or any hospitals, right? We go, we get admitted, we get treatment, and then we get discharged, right? The payment for that in India, either we have to pay, before getting admission, we have to submit the deposit, then depending on do we have an insurance policy, not insurance policy, then either we have to pay or we have to submit the claim to insurance company, and then there is a third party administrator they do, and that's how we have. In insurance company in India, we have a public listed insurance company, general insurance company, and then there are private insurance company, and hospitals are also government hospitals as well as private hospitals. But in United States, even if you go to physician, doctor, or you go to hospitals, the payment, for that service for the hospitals and that physician comes from the insurance company, majority of that. And within that insurance company also there is government insurance, and then there are private party insurance involved. So all this process when a patient comes in contact with the medical practitioner or hospital, then he has to schedule the appointment, he has to go, he has to register himself, he has to need some financial counseling, whether what money will come from insurance. So that process, then he gets admitted. When he gets admitted, diagnosis, treatment, all these are required to be coded in certain particular format. That particular format, then one will have to, or the hospital will have to create a bill, submit it to insurance company, follow up with the insurance company, what happens on this particular claim. Then insurance company will pay. Not that every time they will pay in full, sometimes they will not pay full, they will, slight underpayment as they call it, they will not pay in full. So for that, someone needs to follow. 100 rupee claim, you are paid only 90 rupees, what about 10 rupees and things like that. Now everything that what we have talked about, do you know that ours is a company which do this work for the customers in US, and majority of this work wherein a customer is or patient is not required to be contacted. It's being done from India. So this is the level of business opportunity, or this is the level of business that is there, and that's how India is contributing to this United States agenda. In India, R1 RCM, and we are 100% subsidiary of our parent company. We work only with the customers, our own customers. We don't do this here for other set of customers. Our company globally is operating for more than 2 decades, right? In India, we started in 2007. We started in India 2007 with few employees in Delhi NCR. From 2007 till 2015, we grew up to 1800, 2000, because that is the time even US customers, our company was experimenting whether this work can be done in India, really, with the technology and this. But when they saw that our country is able to not only do the work, but can produce the real good value, quality, accuracy, they have the talent which is required to manage the scale. That's when we started investing in talent, in facility. 2017, we were in Delhi NCR, in Gurgaon and Noida, 1800 people. As we speak today, over the period of last 5 years, today we are 13,000 people organization. We have offices in Gurgaon, Delhi, Hyderabad, Bangalore, and since yesterday, Chennai. This requires a big round of applause for Chennai, right? Actually, the demand and growth that we saw that's coming in, what we require. We have our own technology, and technology is very, very good, integrated technology, which is able to manage this revenue cycle, transaction, complexity really, really well. We have shared services, from where the work gets done in United States, in India, in Philippines. But the third part that is required to operate this technology is the talented workforce, right? Somewhere mid last year or towards the end of the last year, we contacted one of the top consulting company in India and say, hey, you know what? We really, really require a very good, bright talent. What part of India we should expand our business? They did. They came out with their studies based on various parameters, and they said Chennai is the place that you need to be. Was Chennai new till these consultants tell us? Answer is no. Because as I've said, we have offices in Hyderabad, Bangalore. Many Chennai-based talent are actually working with us out there. So we were familiar of what value Chennai can bring to the table. We were operating with some vendors who are based in Chennai. So we were aware of this talent landscape. So gut feel said that we need to be in Chennai, and this top consulting organization who did this study for us, they also said this. And that's how we are here. Very happy to announce yesterday the facility. You have had the round of facility? No. Okay. So after our interaction, you please see the office, our facility. Yesterday we inaugurated. We did a puja, very felt really, really good, and we onboarded our first batch of 20 local talent in Chennai. So as we speak, they will go through the learning and training. That's how we are here in, and now we have to, because the demand, the growth in US is very, very positive, is growing up. Now the response, as I was telling you, the demand and the growth outlook is very, very positive. Okay, and now it is the added responsibility of us as a team members. My team members are standing there. Is to how do we get the best of the best talents? How do we train them really, really effectively well? And then with our technology and with these best people, how well we serve our customers, and that's how we grow. So that's the modest journey of our company in this country. I would say the growth journey has just started. We want to really, really serve our customers well, because we know if our employees are happy, our customers are happy, the growth will come. Thank you very much today for joining in, and now I will let my colleagues talk about it.
So while we had this Big Four do this survey for us, I think some of the things that we already knew, and they kind of conquered what we were expecting. And big reasons are the talent that's available here. The education system that exists in Chennai, and therefore a lot of fresh talent that's there. The work ethic, to what Abhijit was referencing to. We've already had our experience of in our other offices hiring people from, or some of our colleagues who come from Chennai. So when we work with them, seeing the work ethics or the culture that they bring, I think that excites us a lot, and therefore became one big reason why we wanted to be here. And obviously this is complemented by the overall infrastructure that we've seen in Chennai in terms of the office spaces, the large office spaces that you can get here, the road transport, connectivity and all of it. So therefore obviously became an obvious choice for us to be here. And I'm sure the building of this office is one of those examples that this truly is a place that we are very excited about.
Our associates are in different, divided like 4,000 in each location between Gurgaon, Noida, Hyderabad, and some in Bangalore. We're really hoping that Chennai also, and I'm sure we're very, very certain, has the right talent for us to be growing very rapidly to reach those numbers. In the next year itself, I think we will definitely be hiring 3,000 people. The great part, even though the work is very complex, we do think we have the right amount of training. So we don't really need an engineer, we don't need a pharma person. Any graduate we can actually train and make ready. Like we really train for 3 to 6 months, we take people through training, but we're confident that once, as our employees, they've gone through learning with us, they will make excellent long-term employees who will be experts in revenue cycle. So that's our hope. Anything, plain graduate. Any graduation degree is fine. But we take them through, what we do, we have, over the period, because we've obviously been hiring a lot, we've figured out a few tests that we can do. So you can come with any graduation degree. We will just put you through 2 or 3 basic tests, 15 minutes kind of tests. If you clear through those, a simple interview and that's it. We're actually able to complete the whole interview process in a day and move forward.
Employment opportunities apart, now that your presence has already been felt at places like Hyderabad and Bangalore, now that you landed up here at Chennai, is there any kind of special kind of USP kind of modus operandi which you're contemplating of implementing here so that your presence could be effectively felt here too?
Right.
So I really feel that Chennai will be able to do as well as, there will not be a separate process, but our expectation is that the talent pool here is much larger.
Okay.
Because of the number of education institutes, you're asking a question on what degree. Actually, in other places, sometimes I'll say, hey, even if you're not a graduate, you come. But, in Chennai, I can actually have everyone who's a graduate.
Okay.
So we personally think that will make a lot of difference to our ability to scale fast. we will not need to tweak anything. We should be able to, we're very, very positive that we'll be able to grow as fast as we want.
IT and medical industry also.
Sorry?
Medical industry.
Sorry?
Medical and IT sector.
Okay, so as I'm saying that our customer segment is health systems,
Yes.
so hospitals and group of physicians in US. And two things are required to execute this business. One is a sophisticated technology platforms wherein all these transactions, as I was saying, claims will have to, workflow management will have to pass through this technology, and during each phase of this transaction is going, a talent or a employee will have to determine that what value addition should I do so that it will move forward and finally resulting in a payment for the claim. That's a logical output of that. So the technology that we have is in-house proprietary based technology platform which are designed to, get this workflow smoother, faster and productive. So if the question, and whatever design, development, product management, maintenance, support is required for our in-house technology, that is coming from the within. And so to that extent, yes, we do have a technology staff, but our large proportion of employee base is actually working in this revenue cycle management field that we talked about. So captive in-house technology, not something, a software as a service we are selling it to end customers. No, that's not the area that we are.
Can you mention some?
3 to 6 months.
Yes.
You are paid.
Yes. Everyone is an employee from day one.
Day one.
Yeah.
Yeah.
So every person gets salary, provident fund, even transport, even things like insurance for themselves, insurance for parents, from day one. We even have new age benefits like from a healthcare perspective, we will have pandemic hit. We used to have our offices are similar to this. We used to have a doctor in our office. Then we realized, how do we give that service to our employees? So we said we will tie up with Practo. So all our employees currently can actually use Practo, the app, if you remember, to get free consultation from doctors.
So even those employees who are getting trained for say
Yes,
6 months
yes,
or so,
yes. They're all-
it's not a kind of stipend. They are on the
No.
payroll.
Yeah,
They are on the
They're on
payroll.
payroll.
Yeah.
They're all on payroll. We also, again, because all our employees, we have so many locations and, different kinds of people. We also work a bit in shifts. So we've even got CultFit as an app. You can exercise at home. You can exercise with your friends of office. So we're trying different things so that, it's not just about doing work and getting a salary. It's about also having a better lifestyle, a better quality of life for everyone who works at our.
Okay.
Is that is a bond or
Package
anything?
you are offering,
I'm sorry.
initial package you are offering.
There is no
Process.
specific, but we are definitely market competitive, and we stay ahead of the market. But I'll obviously not share the number, but definitely ahead of the market.
All
No
these,
bonds,
No
all,
bonds.
No bonds.
all these,
Minimum years they have to here
No.
working nothing.
all these recruitments are done directly or through agency?
Agencies or
We will hire, we obviously hire through a lot of channels. We'll hire through recruitment portals, we will hire through agencies, we will hire on our own. So it really, or walk-ins, it'll really depend. And it really depends on what kind of demand we have.
Will you get-
At some stage we will. Not in first year is too hard for campus recruitment because we don't even have, first 20 people have come. We will need managers, we'll need the whole company setup. And then we will definitely tap the fresher talent. Yeah, fresher talent is definitely part of what we call right out of college. That is part of our strategy to hire them. So we don't look always for people who have the similar experience. We will hire for them.
any websites to apply for this job or anything?
So
Details you have given.
Yeah, so I think you can apply through the
Even in the
careers
press
website
release,
that we have.
There is a QR code you can
Yeah.
enter. And and even in the.
Yeah, so you reach our
digital
careers
version,
website.
Yeah, it will
And
directly
then
take you
it'll
to-
direct you.
When you hire through agencies, those employees will get the benefits,
Yes.
same benefits you are providing for your.
Correct.
Yes, so every person who joins R1 is an employee from day one. Every benefit that I have talked about comes from day one.
Day one.
So, I mean, how many clients would have corporate hospitals, health systems, and physical?
Right. So as I've said that we are the captive global capability center for our US for company which is our based in headquartered in US. In US, our company is a publicly listed company on NASDAQ, and based on the guidelines of company guidelines and also stock market guidelines, we are not entitled to share the sensitive information about the customers, the revenue, and this part. So I would be I'm guided by not to disclose these numbers.
So, what's the market share?
Okay, let me put it this way. US healthcare as an industry, right? It's a $3 trillion industry. So that is the industry size. Now, this US 3 trillion industry, revenue cycle management is a portion of it. So not entirely 3 trillion is a portion of it. Now, in this industry, revenue cycle management, there are professional companies like us. Then there are a few unorganized sectors or not organized companies, so to say. They are also, their data is not published. But more importantly, many of the US hospitals are managing their revenue cycle operations on their own. So for them, that's an internal cost, right? Now what they are realizing as they are growing, or when this pandemic hit in last 2 years, right? All the volumes went down, business kind of got into it. Then they realized that this is not our core competency, managing these financial processes of creating a bill, submitting a bill to insurance company, collecting the money. That's not. Whatever capital we have, we should invest in upgrading our medical infrastructure. We should invest in this. And now they are saying that we won't be able to invest in the technology of revenue cycle management. We won't be able to get the talented workforce or attract talented workforce. We would not be able to handle the volume if that business comes to R1 RCM. R1 RCM works with hospital A, B, C, D. So if you add this volume, we are able to take the benefit of that economies of scale, which they can't. So that business is not published. I would only say this. We are in the early innings of a long-term. We are in the early innings of a very long-term, significant business growth opportunity, and we have barely scratched the surface. We have not fully utilized, exploited that market space. In this space, R1 RCM, by virtue of our quality of execution, what we have done over the period of last 20 years, has earned a good reputation and in a very humble way a right to serve our customers well. Because we have served our existing customers so well, we are getting the good feedback and referenceability for other customers inviting us and to participate into a discussion and conversation. So, as I've said initially, in 2017 we were just 3,000 people organization. Today we are 13,000 people organization. We have plans to, as Swati has mentioned, we have plans to hire 3,000 in a span of time. So this is the growth that is happening, which is a kind of the growth outlook that we are seeing in the early part, and where we have taken the leadership position of a good, trusted partner for our customers.
And we as an organization are growing both organic and inorganic globally. Since this information is public now, we've already kind of closed an acquisition of another big organization in US, and at the same time we're signing new customers. So we as an organization are not just signing new customers, but you know, growing both organic, inorganic, and trying to provide the best in class services to our customers in US.
I'm asking about Indian clients.
No, we only serve
We only serve
customers in
US
So
US.
it will be your US back office.
Correct.
Yes.
US back office.
Yes.
You are working for US.
US company,
Yeah.
100%.
Yeah, we are a captive unit of our parent company in
In
US.
US.
So we will not be serving any Indian hospital.
Yes.
So we're very, like, we are the, as you rightly said, we are the back office of our US company.
Correct.
So that is very clear.
Yes, that is very clear.
So what will be people are working in US time or Indian time?
People actually work 24/7, depending on the kind of work that is there. Things that can be done during the day are done in the day. Things for which people need to work at night, work is done at night. And that mix keeps on changing based on the work we do.
Basically, based on the requirement.
Yes.
Exactly.
The time frame is set.
Yeah.
In case you're required to,
Yeah.
be available, make phone calls, you work US hours. So there are things which can be done as the back end.
Yeah.
Some real time work has to be done.
Yes.
Yes.
During night also.
Yeah,
yes.
correct.
When they are working, they have to,
Yes.
they have to coordinate.
Correct.